This episode of the podcast is brought to you by Canna Health.
Hey cannabis consumers, have you ever consumed a cannabis product thinking it'll make you feel a certain way, but then it doesn't? Don't you wish you had a clear understanding of your own DNA so that you could make informed decisions about what type of cannabis products interact best with your system? Well, now you can with EndoDNA. EndoDNA is a simple DNA test that maps your entire endocannabinoid system and then matches that summary with a specific cannabinoid ratio and terpene profile that best aligns with your unique genotype. Imagine being armed with personal information when visiting a dispensary. You'll have the knowledge and power and capability to purchase products that best align with your genotype. Visit their website to purchase the EndoDNA Collection Kit and Endo Decoded Report at endodna.com/products and use the promo code CONNECT15 for a 20% discount. Again, that's endodna.com/products and use the promo code CONNECT15 for a 20% discount. The future of cannabinoid therapeutics is here with EndoDNA. Hey Scott, how are you, man?
I'm great, Kevin. Thanks for having me. Great to be
Absolutely, here. Man. Yeah, thanks for making time for me and the audience today. Really looking forward to talking with you. And I think a good way to kick this conversation off, Scott, is talking about the current mental health crisis, not only in this country, but worldwide, and how, the root of most mental health concerns, is rooted in high stress and lack of sleep, right? So I know that you're the founder and CEO of ZIPPZ, which is personalized CBD therapies for sleep and stress. So let's first talk about this current crisis that we're living in, and then we'll get a sense about your background and how you got to where you are today.
Great, thank you. Yeah, it's amazing. Pre-COVID, 2/3 of adults said they suffered from sleep or stress. Now it's over 80%, right? There's the macroeconomic environment, the political environment. Like, if you're not suffering from stress, like, you're not human. You can't not. And sleep and stress, as you said, once you have it, once your body is producing that cortisol and that stress, you're just in a downslide. And that's why over 70% of adults suffer from this. And over half the people said they haven't found a viable solution because it's freaking hard.
Yeah. And there's so many different remedies, right? And different therapies that people seem to gravitate to. I mean, just last night, my wife and I were at her stepdad's, celebrating his birthday. And one of the aunts is talking about melatonin. And this conversation, this debate comes up. Well, melatonin is good for you. Wait, no, it's not, because it's a hormone. Wait, no, it is. So, I mean, talk a little bit about some of these traditional therapies, maybe the newer therapeutic therapies, and then how CBD and other minor cannabinoids like CBN are a good alternative.
Yeah. So, and I've been in a lot of these categories as a marketer, but I call them categories of failure, right? Smoking cessation, dieting, I was CMO of eHarmony, relationships. These are categories that people are always in and they're out, right? They're on this diet and they're out of this diet. They try this dating site, they're out of this dating site. They try this for sleep. I tried over-the-counter remedies. I tried prescription remedies. Like these are categories of failure because people are constantly trying to get relief, and it's hard because, as you pointed out, like even when you talk about sleep, Kevin, people say I have a sleep issue, what does that mean? And some people mean I can't fall asleep. That's a sedation issue. Other people are like, oh, I could fall asleep, but I can't stay asleep because of my anxiety, or I can't stay asleep because of my pain. These are all very different. And unless you have a physician or someone guiding you through the exact remedy for you and your metabolism, it's a guessing game. And it's why people are in and out of this category. And then, of course, CBD and cannabis comes up, and that's the next thing. And people are, can this help me? And that's where I got interested.
Mm-hmm. So let's talk about that. I mean, your journey, you mentioned the categories of failure, and I think it's interesting you brought up eHarmony being one of those categories when you were the CMO there. So talk a little bit about your background, man. What brought you to cannabis?
So it's interesting. My first half of my career, I was building wellness products for startups and huge mega CPG companies like Procter & Gamble. And I also sat on two multi-$100 million pharmaceutical boards. So I got a chance to see how products were brought to the consumer through pharma companies. Then in the 90s, I came out to Silicon Valley to seek my fortune in the dot-com era. And I've spent my time building platforms using data to match people to products, that is eHarmony people to people. And when I sold my last company, I'm a serial entrepreneur. And one of the reasons that I start companies is I suffer from anxiety. And instead of looking inward and making myself crazy every day, I look outward and I try to solve problems. And then I set up companies. Anyway, I sold my last company. My anxiety spiked because I didn't have business problems to solve. And one of my friends said, it wasn't Jim Belushi, but dude, you should go smoke some weed. And I'm like, I did that in high school to try to be cool, which didn't work. But I learned about microdosing. And so I went to a dispensary and I went to this bud tender and I said, I can't sleep, I have anxiety. And he sold me $260 worth of products and I took them home and it was awful. And I thought, in what category, Kevin, in what category you get medical advice from a 26-year-old kid in the store?
Why was it awful? Why was it awful? The experience, or were the products bad also?
It's kind of like if you were driving, or use me at my age, I'm driving to the office and all of a sudden I get a heart pain. I'm like, oh God, am I having a heart attack? Oh, I see a pharmacy. Let me drive in and ask the pharmacist, should I go to the hospital? Like, what does he recommend? And I go in there and the cosmetologist, the 26-year-old woman selling eye creams is there. And she's like, he's really busy, but let me just grab a bunch of these heart pills. Here, try this. I hear this worked great for your heart, but go low and slow. Well, you would never do that. You go, that's stupid. But here I am with anxiety and sleep issues, which are medical type of issues. And a 26-year-old kid is handing me what he thinks will work for me based on whatever he spiffed on, whatever he used, who knows? But it's not the way it should be, right? How should it be? In a normal category, in pharmaceuticals, big pharma would study your receptors in your body. They would figure out which receptor they're going after. So for example, Ambien is one of the top RX products that goes after the GABA receptor. So a pharma company figured that out. They taught a doctor, hey, if you think it's the GABA receptor, recommend Ambien. And a doctor then has 5 or 6 or 10 different possible weapons when a consumer comes in. They do a diagnosis, they ask the questions, and they go, oh, I think it's this, but we could do calibration and titration, and gets the consumer to get to a place where they get relief. Why don't we do that with cannabis, Kevin? And I think the answer is
Schedule 1.
FDA, yeah, exactly. Schedule 1, the FDA and pharma are on the sidelines. So here I am with a pharma background, with a wellness background, with a tech and platform background, with a lot of connections in pharma and medical. And I thought, wait a minute, what if I build a company emulating the best of physicians, pharma, FDA, and do all the things that would be done had cannabis not been Schedule 1? And that became the genesis of ZIPPZ.
So, okay. So you're basically trying to serve as and we got to be careful with the terminology here, right? With the lack of guidance of the marketing and sales messaging. But basically, you're serving as kind of the therapeutic outlet for minor cannabinoid products to help with sleep, anxiety, and stress. And is it science-based?
Not voodoo science, actual science. So what's super interesting is, first of all, let's talk about cannabis, and let's talk about, it could be CBD, but it could be any other cannabinoids. Amazing, amazing plant. Been with us for thousands of years. Our bodies have developed an endocannabinoid system is real thing. We all get that. However, and not to put down the plant, because the plant she's amazing, right? But I equate it to sugar. Sugar is an amazing ingredient. Amazing. It put into other foods, it creates amazing things. But I wouldn't call sugar a dessert. You could use it at that if you're poor, whatever, you have a spoonful of sugar as dessert, but you add it with milk solids and you make Haagen-Dazs and you make donuts. It's an amazing ingredient that can make a great product. We treat in this country cannabis as an ingredient / product. And my hypothesis was sleep is so complex, asking one botanical to do all of that, sedate me, fix my anxiety, fix my my pain. Like one plant, one ingredient can't do it. So what we created and our patent pending are using 32 different botanicals in addition to CBD, based on what each consumer's needs would be. So they are therapies that have been scientifically formulated. The average product I have has 6 or 7 different botanicals. They have the same amount of CBD as other products, 40 to 60 milligrams, but they also contain, like I said, each product has different botanicals, but 5 or 6. And I guess my analogy, Kevin, is musical instruments. CBD is a drum, makes good music. Want a drum, beat that drum. You can beat that drum 1,000 times. It's never going to make a symphony. You need to add wind instruments, percussion instruments, other instruments to accompany, to create an ensemble effect. And that's what we do scientifically with our ZIPPZ product. Consumer comes to ZIPPZ.com. They take an assessment, it takes 3 to 5 minutes. It is an assessment that a medical cannabis professional would have done, but we digitized it, makes it easy to do. And then based on that, we recommend different formulas to consumers. We send them 2 different ones that are, again, drilled down from what they told us. They try them both at home, 5 nights each for sleep, and pick the one they want, and they can subscribe to the winning formula. So again, if you think about what I talked about, it's assessment, a physician doing a patient assessment. I do an online assessment. Recommendation, we recommend, depending on what your needs are, 2 to 4 different formulas to trial. You trial them at home, see what works, and then you calibrate yourself up to the winning solution. So we are trying to emulate the best of what a Pfizer or J&J would have done had they not been stuck on the sidelines. Mm-hmm. By the way, and 90% of consumers play back in our research, oh my God, at least one of your formulas have dramatically improved my sleep or my stress. So we know the efficacy is there. But again, Kevin, to your point, it's because they're scientifically created, personalized to you.
Yeah. And when you say, a couple of questions to unpack that. So when you talk about the personalization of your process, is it a questionnaire that the consumer would fill out or complete, or is it like a DNA test to map their genotype?
Great. And by the way, I think the DNA, like Endocanna Health, really smart, really great. I actually did it. I actually took my results and my 23andMe results and sent it to Endocanna. And sure enough, came back. You want to stay away from high THC. You have a tendency for paranoia. But so this is an online assessment, just like a doctor would do. Keith, tell me about your needs. I have sleep needs. Well, what does that mean? What's personal to you? Scott, I can't fall asleep. And when I do, I can't stay asleep. I'm a male that's 38 years old, or I'm a premenopausal female, whatever. Because premenopausal female versus my mom, very different formulations, because you don't do well with certain cannabinoids and terpenes, you do better with that. So it's an online assessment. It takes about 3 minutes. And then what you get back is an incredibly personal report to you. Kevin, you told me blah, blah, blah. That's why these botanicals. You told me blah, blah, blah. That's why. So what you get back is the equivalent of what a physician would give you back had they actually taken that clipboard, write it out, and hand it to you, versus just a prescription. And then again, you get these delivered to your home, $29. And then you see what works for you, and you go from there.
I like how you provide the 2 options, like you said too, right? Because that's still at that point, as a new consumer, you really want to probably dial it in, have some options. So I think that's a nice, I guess, perk for your services is the options that you get.
And we're all different. So one of the things that some people, say, I think you brought it up, Kevin, melatonin is great. Melatonin's a hormone. And all of these, like Ambien or melatonin or whatever, they will work short term. The issue is on all of these, if you take these longer term, you're supplementing your body with melatonin and other things. Your body says, oh, I probably don't need to make it myself. Those receptors dry up where now you're hooked on that.
Deficient, yeah.
Yeah. So what we do have melatonin, but if melatonin effective formulas are 3 milligrams to 6 milligrams, we have 1 to 2 milligrams. So someone would say, well, that's not an effective level, Scott. You need 3 to 6. And go back to my symphony. The little triangle you're ringing or the flute you're playing, you're just trying to add to the totality. So tickling 7 receptors around sleep, pain, or whatever in my formula is better than just trying to punch one receptor just with CBD. So we have a small amount of melatonin in some of our formulas, not enough melatonin on its own to work, but when you add it to with lavender and skullcap and CBD and whatever, in total, you get a safe and effective amount of botanical network pharmacy model parties. Yes, we adhere to the network pharmacological model, the precision model, but you get the point. It's don't just take one thing, CBD, and bludgeon your body. Bring in a supplement of these things, create a symphony in your body, and that's what creates 90% relief for our ZIPPZ customers.
Yeah. I mean, I see your point in that, like, there isn't one all be all solution, right? Cannabis isn't the end all be all. There's other botanicals, other natural alternative medicine and therapeutic medicine that can help, right? And so entering the cannabis industry or the CBD industry, did you catch any pushback or people, because people talk a lot about the entourage effect with cannabis, right? Because you've got the minor cannabinoids, the flavonoids, the terpenes, all working as this type of orchestra, as you put it, right? So when you're entering this space and talking about added botanicals and stating basically that the minor cannabinoids aren't enough, what's the reaction with the industry?
Well, it's interesting because people don't know. Like I have friends that are smart, like way smarter than me. And when I ask them about, they go, "Oh, I'm on the CBD." I'm like, well, "What do you take?" "I don't know, the CBD."
The CBD, yeah.
They literally, the Facebook, they literally don't know. But it's funny if you talk about a symphony, if you hire a reggae band and you're getting married, you might be disappointed because you didn't, like, why ordered a band? Well, yeah, but a band is a reggae band, there's a brass band, there's so
different genres of music, right? Yeah,
exactly. So your cannabis, there are different strains, right? Forget about indica, sativa, whatever, but there are relaxing strains, there are energizing strains. There, as you said, there are hundreds of components and cannabinoids or whatever. Certain terpenes are not good for my mom. Certain terpenes are better for my daughter. And so when I talk to people and they think they get it and they think of it, they go, "I have no clue." Well, why are these people allowed to sell it? Well, again, the FDA is on the sidelines. And so it's a major opportunity. I mean, this is an amazing plant. It's been disrespected for all the reasons, but now that it's becoming respected, I feel like I'm one of the first ones on the, and again, I have a background of pharma and tech, but this is where it's all going. In 5 years from now, just selling CBD or even just selling THC in dispensaries is just dumb, and it's going to change. And I'd like to be on the forefront of changing that.
Yeah, I mean, I think that you're onto something in that the future of medicine is going to be very dialed in, right? We're gonna have a really, really clear understanding of our own genetic makeup and what our body positively responds to and what it negatively responds to, right? Or it doesn't respond to at all. And that's where I think, to your point, the botanicals, combined with the minor cannabinoids, terpenes, flavonoids, all that together for the right person's genotype is perfect. I mean, that's going to be something that's going to be revolutionary.
Yeah, I agree. But again, my pushback to that is, and what I see in the industry and what you see all the time, if all you do is sell sugar, then you're going to tell the best sugar story you can. I'm the purest sugar. I have I am full spectrum sugar. I am sugar from the Mauritius Islands. I have but it's still sugar. You're still arguing about why your sugar is better, pure than anyone. And I'm saying, but you better, but as a product, you need to be more complex than just sugar. And that's what I see the industry is. I'm a prettier package. I have a prettier sugar flavor. Again, at the end of the day, you're a commodity and you're going to be wiped out in 5 years when it's legal or whatever. So I want to create actual working complex products using that amazing ingredient, sugar, CBD, whatever. But otherwise, we've reduced the plant to being an ingredient, and that's criminal, especially for the people that this thing, it is life-changing. I get back, Kevin, stuff from people. I've been trying 20 years and you're a lifesaver. This is the first time that something actually works for me. And I tried CBD and whatever. And I'm like,
Yeah, I see your point. I mean, I like on the medical side for sure. I feel like they are going to get left in the dust if they're just focusing on that particular thing, because like you said, there are different botanicals and alternative ingredients or therapeutics out there. But I mean, on the recreation side, like I I use it to relax, and I don't need any additional botanicals and whatnot. I mean, I'm happy with flower. You know what I mean? So I think that there's still going to be that consumer base, or maybe we just don't know what we don't know at this point, and the market is so still so immature that these products will evolve with these added botanicals. And we talked about these botanicals. Scott, what are these botanicals? You mentioned melatonin, but like what are these other botanicals that we're adding to make this symphony?
Yeah. So some of the other, and I want to come back to your cannabis one because I think you brought up a really interesting point. So we have uh, magnolia bark, we have chamomile, ashwagandha. Ashwagandha actually is what they call an adaptogen. It's one of the like 9 plants in the world that actually adapt in your body to find out what Kevin's cause of stress is to reduce it. Kudzu, black pepper for absorption is just some of those. But it's interesting what you said about even for flower. So people smoke for relaxation,
Recovery, stress.
focus, stress, energy, romance. And sometimes you get the benefit you want. Sometimes depends what you bring to the party, right? What you've done that day, your mental state or whatever. My contention,
I would say in the illicit market, you don't know what you're getting in terms of strain. So like you don't know what that's doing with matching with your genetic makeup and how that's affecting your body. So to add on to what you're saying, yeah, we don't know
yeah,
in states where it's not legal. Yeah.
right. So to your point about the medicinal side, you get that. But on the rec side, we're working on products that we actually are adding in adaptogens, botanicals, which also on its own give you focus, recovery. But together, it enhances your cannabis to give you a better, more focused mind and body high. It also addresses what your body needs. So not only are you masking, I had a shitty day, my stress levels were up to here. Smoked some flower and it took my stress levels to here, but my cortisol is still pumping that stuff out the next day. So taking botanicals and adaptogens, the next day, your body is being regulated and cortisol levels are going down. So it's actually a healthier high. So I believe that this vision could go beyond medicinal remedies for sleep and pain, and also for recreation. But for recreation, I think there's a lot we could do to enhance the THC. But let's go back to the medicinal stuff. Again, CBD, an amazing ingredient, can help people. Our point is let's add other things, make it a real product, and really help people. And again, we've proven that we help 90% of people. And it's not a surprise. It's interesting. When we put our formulas together, we went to soft gel. They're soft gels, by the way. And soft gel company said, we put fish oil or CBD oil. We don't put 6 or 7 or 8 different ingredients in one pill. Like that's breaking new ground. But that's what we did. And my investors said, can you test it? And I go, no, you have to make these complex products to test it. You can't. So we made 7 figures worth of product. And my investor said, well, how do you know it's going to work? And I said, if CBD kind of works for people, if 1 beer kind of gets you buzzed and you want to get buzzed, 2 beers are going to be, and 3 beers, I don't have to worry about getting you buzzed if 1 beer gets you buzzed. So if CBD is kind of working and I'm adding all this other robust botanicals to really do the job on your receptor, I'm sure it's going to work, but we didn't know. And then we did the testing and got 90% of people saying at least one of the ZIPPZ products you sent me in my trial box, has worked for me. And Kevin, you didn't have the benefit of trying the product yet, but when you get your package in the menu, you open it up, it has your name. It talks about, Kevin, you told me these are your anxiety needs. And because of that, here are the exact botanicals we're sending you that map to what you told us. So people are freaked out. They're like, can't believe that for $29, you've given me these complex formulas and you've guaranteed them. So if it doesn't work, we'll send you other formulas, we'll give you back your money. I will tell you that of all the customers that we've gotten, no one asked for their money back. Even the 10% of people who go, you know what, Scott, it's didn't work for me. But I'm a hard case. But this is amazing. I'm going to tell my wife, my girlfriend, my brother-in-law, like, what you've done and personalize it. So even when we fail to help the 10%, they're delighted by what we've done and they want to recommend it to other people. So we know we're onto something big when even the few people you can't help want to sing your praises to everybody else.
Mm-hmm. That's great. Yeah. And when you mentioned earlier, you got me excited, man, because if there's a way to enhance the current high that I'm experiencing, then, hey, I'm all for it, so I'm open to the idea for sure.
Well, it's interesting. We had this idea. Everyone loves it on paper, though. It cannot actually be a thing. And I said, I don't know. We know that adaptogens and some of these botanicals alone kind of give you that state. We know what cannabis does. If you put the two together, could it be enhanced? And we found some experts who said it could. And we just tested it and found 4 formulas that I think, Kevin, will put you on the list next time that you'll love. It's like, oh my God, I wanted a more focused high, and this was incredible. So again, I think there's a massive opportunity in both the CBD and the pure cannabis, THC, marijuana space to take this amazing plant, this amazing drum, and add other things to create this amazing thing.
Yeah, absolutely, man. And, as we wrap up, Scott, I'm curious because you mentioned at the beginning of this episode that you're a serial entrepreneur. So now being an entrepreneur in the cannabis / CBD space, how is it different than any other industry you've been in?
Oh my God. So I went to MJCon 3 years ago. I got on the airplane, got my little lanyard, MJ, my mom's gonna be so proud of me. Her son went to Ivy League school to end up selling weed. Kevin, it was the most miraculous thing. The people, this was 3 years ago. So it's still changing, right? Old guard, new guard, now old gray hair people coming in on packaging and lab and stuff and, bringing in science. And, but as because you've been in the space way longer than me, because banks, you have to do a lot on trust. So there's a lot of handshake, a lot of hugs, a lot of, how do I feel about Kevin? Could I trust him? I got more hugs and hugged more people pre-COVID at that convention where it was, everyone wanted to know, like, are you in it for the right reasons? Are you in it to make money or to help? And I said, well, I want to make a ton of money and build a billion-dollar company, but I want to do it by helping, millions of people sleep and whatever. But I felt the culture was incredibly fun. The people were all open. Like everyone's saying, look, I may not be at this company next year. We're competing now, but maybe next year we won't. So let's work together. So when I came out here in 95, it was, pre-.com, same thing. You might have been working at a .com company and said, Scott, I don't know if this is going to work, but let's help each other. Same thing. I love the culture. I love the people. I love the vibe. And what I also loved is, to some degree, the naivete where the plant was everything. And I'm saying it's an ingredient. It's an amazing ingredient, but we could all take it further. But I've been so enjoying this journey because not only by helping myself and hopefully helping millions of people building a massive company, I don't, and this, you can't go to it's like someone saying, if you're in the liquor business or, any of the sin business, oh, I hate it, man. I have to go to liquor convention. There was so much drinking. Yeah, that's what they do at a liquor convention. But so yeah,
what's awkward about that though is I've been to CBD conferences, but they're in Texas, obviously, where it's illegal cannabis is, and everybody's drinking at all these cannabis hemp events, because of the illegality. So it's ironic.
That's funny. So yeah, no, I love the culture. I love the nascence of this industry, and I love the fact that the things that big pharma, that big pharma is not perfect. There's issues, but the things that are smart, what they do to help people, haven't been done in this category. And I'm like a kid in a candy store. I'm like, I should not be allowed to build the next J&J. Like that's, who am I? Yes, I have a formal background, I have a CPG, but the fact is that I could do it in this incredibly fun category with incredibly cool people. And with 90% of people coming back and saying, ZIPPZ, help me, it's life-giving. So it's just a joy to be in the business. And I don't know if we're really going to build a billion-dollar company, but that's what we're going to try to do.
Love it. Yeah.
Well, again, helping, tens of millions of people, ZIPPZ.com, get that kind of relief.
Absolutely. Yeah, no, it's a great industry with great people, very passionate people who are ultra resilient and just super hardworking. You know, their ultimate goal right now with this industry being in its infancy stage is, you know, helping and ensuring that this plant is accessible, right? And the
Right.
botanicals that go along with it, right? Just anything
Absolutely.
that's natural and that is a better alternative than what we've been told is the way to manage pain or stress or anxiety. So it's
Yeah.
good. Scott, I want to leave the floor with you before we wrap up. What's on your mind? What do you want to leave the audience with?
No, I agree with what you said. This is a plant that needs to be evangelized. The products behind it to be evangelized. I'd like to believe that our product is on the, ZIPPZ.com is on the one of the forefront of bringing science and data to help millions of people, and putting our money where our mouth is. So it's $29, not that much money. We give you it all back if you're not satisfied. Like I said, 90% of people are, and 10% are like, I don't want your money back. This is great. I'm just sorry that you couldn't help me. So I want to stay in this business. I want to make sure that you get my product for recreation when we get there. Sounds like I'll be on touting that maybe in 6 months, but keep doing what you're doing. I love your show, and I'll come back when I have other news on the recreational product.
Awesome, man. Thank you so much. Appreciate the compliment, and thank you for all your insights. I do look forward to trying that recreation product when it's ready, man. To put me up, sign me up for the list. I'll be the guinea pig. I'm happy to do it.
All right.
Awesome. Well, thank you again, Scott, and thank you all for listening. Bye.
Thanks, Kevin.